Thank you. When I was a junior sister in an emergency department, I worked with a healthcare support worker called Mrs. T. I call her Mrs. T because I have absolutely no idea what her first name was. None of us ever dared ask. She'd been there for years, and she was always able to spot a deteriorating patient. She was never wrong, and she was utterly tenacious. If she was ignored, she would march to the consultant wherever he was, and she would demand that he saw the patient straight away, which he usually did. Junior doctors were warned to never ignore Mrs. T at their peril. So one day, I mustered up the courage to ask Mrs. T how she always knew when a patient was deteriorating. And she shrugged and she said, it's simple. You just look at the patient and take the pulse. Actually, what she was doing was a rapid assessment of that patient. She was looking at the pulse, the quality, she was looking at the skin colour and the tone, and she was making a judgment based on her years of experience. She said, you should do it. So I did. And Mrs. T made me into a better nurse. She actually made me better at my job. Because we walk through our working lives with our eyes closed, often just trying to get to the end of the shift. And what Mrs. T taught me was that it's never okay to do that we really need to open our eyes and see our patients if we're to understand what their needs are. Much of my career has been spent working in emergency departments, and there, healthcare support workers are often a pivotal part of the team. We all have different parts to play, all equally important, but we can't function without each other. And that's what I thought working with the unregistered workforce looked like. However, recently, Lucy from my team told me that I was never asked my opinion about a patient, even when I'd been looking after them all day. I was really shocked. I realised that in many settings, healthcare support workers are invisible. They're the busy legs paddling the Swan beneath the water. Nobody ever comments on how magnificent, how majestic, how graceful those legs are. But the Swan wouldn't actually get very far without them. So I think we need to change the way we think. Maybe we, the registered workforce and the managers, need to do a bit of paddling for a change and give our healthcare support workers the chance to be majestic. What would happen if we did? So this is Yara. And Yara was looking after a patient called John, who was really struggling to cope with his hospital admission. And she asked him what he'd like to be doing. And he said, I'd like to be at the theatre. So a few days later, Yara came to me and said, can we bring the theatre into the hospital? And I went, yeah, by all means, see what you can do. Didn't really think anything was going to happen. But what Yara did was she approached numerous drama schools in London and asked them if they wanted to work with us. And she got lots of rejections, but eventually one came forward and asked for a meeting. And from that was born a joint enterprise to bring community theatre students into the acute setting. And we've just finished our first course, where the community students and the patients create a piece of theatre together. I have to say it was quite bizarre when I watched it, but they absolutely loved it. We had one lady who hadn't got out of bed for weeks, and all of a sudden she started wanting to get out of bed and walk to the day room so she wouldn't miss these workshops. And this is the beginning of an ongoing relationship with one of the biggest drama schools in London. We get hours and hours of meaningful activity for our patients, entirely free of charge. And all this because we encouraged Yara to realise her vision, and she knew that she would be supported to do so. Mrs. T and Yara are not exceptions. This is Josh and Lucy from my team. And Josh is here today, somewhere amongst you. When I employed Josh and Lucy for a nutrition project called NOSH, I had fairly low expectations, I have to admit. I didn't realise the potential or didn't recognise the potential in them. Now, Josh and Lucy are the first Imperial healthcare support workers to have presented at an international conference, the first to have co-written a book, the first to have written journal articles, and probably the first to have taught loads of different healthcare professionals in the Trust. They are recognised as experts in their field, both nationally and internationally, and they're brilliant with patients too. So what connects Josh and Lucy, Mrs. T and Diara? Well, I think that we forgot about the barriers that separate us, and because of that, something brilliant emerged. And if we stop being territorial and tied to our traditional hierarchical ways just for a moment, how many more glimpses of brilliance would we see? I have to admit, I quite like being the Swan. I like to be gliding along on top, getting all the credit. But I love the fact that I'm here today telling you about healthcare support workers who have inspired me and that I've helped them, in some small part, achieve their potential. Recently, I asked Josh what work was like before he joined our team. And he said, life was going to work and being told what I was not allowed to do. What would our NHS look like if everybody could say, I go to work and I ask, what more can I do? Thank you.